All right, let's jump right in. Today we're going to break down one of the biggest stories in, well, in medicine, in culture, you name it. We're talking about that new generation of weight loss drugs that, honestly, seem to be changing everything.
And I'm going to bet you've heard of them. I mean, how could you not? Names like Ozempic, Wegovy, Mounjaro, they're just everywhere. On your social media feed, in the celebrity news, maybe even in conversations you're having with your friends. They have absolutely exploded into the public consciousness. And today, we're going to unpack exactly what they are and, more importantly, why they matter so much.
You know, the conversation has gotten so big that it's actually creating its own pop culture terms. I mean, Ozempic face? When a medical treatment starts trending like that, you know it's way more than just a drug. It's become a full-blown cultural phenomenon. But to really get what all the hype is about, we have to look at the science behind it.
And here's the wild part. The science, it's not some crazy futuristic invention. It's actually based on a blueprint that already exists inside every single one of us. So to understand the drug, you first got to understand a hormone your body makes all on its own.
Okay, so this hormone is called GLP-1. The easiest way to think of it is like your body's own built-in appetite manager. When you eat something, your gut releases this hormone, and it basically sends out a powerful memo to your whole body that says, all right, team, we're good here. No more food needed right now.
And what's really fascinating is how this one little hormone is a total master multitasker. I mean, check this out. It tells your pancreas to handle the sugar you just ate. It tells your liver, hey, hold back on releasing more sugar. It physically slows down your stomach so you feel fuller, longer, and it sends a direct signal right to your brain's appetite center, telling you to pump the brakes on eating. It's an incredibly efficient system, right?
And that, right there, that is the key to the whole breakthrough. These new drugs, they're called GLP-1 agonists, which is just a fancy science term for molecules that basically copy and then amplify the hormone your body already makes. So, in essence, they're just a supercharged, much longer-lasting version of your body's own natural I'm full signal.
And that one simple idea, just amplifying a natural process, has led to a breakthrough that tons of people in the medical community are calling a genuine revolution. So why? Why such a big word? Well, because the results, they are unlike anything we have ever seen before from a weight management medication.
I mean, just look at the numbers. They really do speak for themselves. For years, traditional methods like diet and exercise might get you, on average, a modest 5% weight loss. But these new drugs, they are playing in a completely different league. We're talking average weight loss of 15% to even over 20%.
So let's break down the two main players on the field right now. First up, you've got semaglutide, which you probably know as Ozempic or Wegovy. It's a pure GLP-1 agonist, and that's the one that delivers that impressive 15% average loss. But then there's tirzepatide, Mounjaro, and Zepbound. This one is what they call a dual agonist. It mimics both GLP-1 and another hormone called GIP. And that extra punch, that's what pushes the average weight loss even higher, clear past that 20% mark.
Now, to put those percentages into perspective, because they're just numbers, right? Well, we're talking about a level of weight loss that, until now, was really only achievable through a major surgical procedure like bariatric surgery. Think about that. This is a massive, massive leap forward. We're getting surgical-level results with a simple weekly injection.
Okay, but the story doesn't stop with the number on the scale. Not even close. The impact of these drugs is creating these huge ripple effects, bringing both incredible new benefits and, yeah, a whole host of very complicated challenges.
So let's talk benefits. Beyond the scale, these drugs are showing some really profound health benefits. We're talking clinical trials that have proven, for some patients, they significantly reduce the risk of major cardiovascular events, things like heart attacks and strokes. And on top of that, they improve key health markers all over the place. So this isn't just about appearance, not at all. This is about legitimate, life-saving health improvements.
But is it all good news? Of course not. A revolution this huge is never simple. And this one, for sure, comes with some really significant questions and complications.
So what are we up against? Well, here are the major hurdles. First, the cost is just sky high. It puts it completely out of reach for a lot of people. Second, the demand is so incredible that there are global supply shortages. Then you have the common side effects like nausea and vomiting. And maybe the biggest issue of all, studies are showing that if you stop taking the drug, the weight often comes right back. And that raises this huge question of lifelong dependence. And all of this just feeds into this central ethical dilemma we're facing. With the limited supply, who gets the drug, right? Should it be prioritized for patients with diabetes and serious obesity-related health conditions, treating it as a true medical necessity? Or is it for anyone who wants to use it for more cosmetic weight loss? I mean, this is a debate that our whole society is grappling with in real time.
So, where does all this leave us? We are standing at the very beginning of a brand new era in medicine. We've got this incredibly powerful new tool in our hands. And now, the biggest questions are all about how we as a society are going to choose to use it.
But ultimately, what these drugs have already done is fundamentally reframe our entire understanding of obesity. We're seeing this rapid shift away from seeing it as a failure of willpower or just a simple lifestyle problem to finally understanding it as a complex chronic disease, one that can be effectively treated with pharmacology, just like we treat high blood pressure or diabetes.
And that leaves us right here with the ultimate question as we look to the future. With the weight so often coming back after someone stops the medication, are we really looking at the first true cure for the chronic disease of obesity? Or have we just created a highly effective but lifelong subscription service to manage its symptoms? That is the multi-billion-dollar question that everyone, from doctors to patients to drug companies, is trying to answer.